We have with us Dr. Sonia Trika, DGHS of Government of Haryana. Thanks a lot for taking time and coming to the second edition of India Diagnostic Summit, ma'am. To begin with,
Thank
I,
you.
yeah,
Thank you, Pratibha, for inviting me.
yeah. To begin with, I would like to ask, can you just tell me how it was, weathering this pandemic and how routine diagnostic tests have picked up during the time? How was the transformation in the diagnostic sector during the pandemic for Government of Haryana?
Oh, I would say it was massive because COVID-19 was a totally unprecedented situation. So, with regard to a test, which was the gold standard, the RT-PCR test for COVID-19, we did not have any facility at the district level, to do that kind of test earlier. So, which is basically the molecular lab testing. We had this facility in medical colleges, but no one thought that the district hospitals needed to have they needed to be equipped to kind of to run those tests. Initially it was through the through the private labs and through the medical colleges that we thought we would be able to have those numbers, but very very soon we realized that if we had to kind of to do tests quickly, put people on treatment, because that it was test, trace, treat. That was the 3T methodology which we were using. We needed to have very quick turnaround of test reports. And for that, molecular labs had to be established. So we kind of established them rather fast. And now each district of Haryana has a molecular lab of its own. And we are able to do RT-PCR tests, not just for COVID, but also for other, for example, for HIV, we are able to do CD4, CD8 counts, viral load assays. So all of that, the investment in the form of equipment, human resource training, all of that is coming in handy now for other disease mixes as well.
So actually, we have like coming out of the pandemic, like that phase is like wading away. So as the COVID-19 brought the wellness into focus, how do you think this collective consciousness of health, should be taken forward, keeping the patient's perspective?
Oh, in fact, I think there is data for this because initially during COVID, this was in 2020 only, the COVID pandemic actually benefited in the way that people started laying a lot of emphasis and paying a lot of attention to their own health. So, if your own data, the Economic Times data itself says that there was 30% increase in one particular, big lab, one of the big labs in India, that there was 30% increase in preventive health checkups of patients, if you compare it with the before COVID era and after COVID era. So I would say that it has had that positive fallout, and many people are now kind of coming in for preventive health checkups. They are paying a lot of attention to lifestyle modification. They're paying more attention to exercise, diet, which is a good thing.
Ma'am, going forward, if you can just give us few thoughts, like what and all is going to come up in the diagnostic sector, like the digitization, any three pointers, if you want to say.
Of course. So I would say that the best thing is automation, which is happening in government sector also. We are using technology in a big way. So whether it is digitization of all hospital processes, so even in the public health sector, and use of AI. So now we do, many states actually have started doing, for example, for tuberculosis. So running the chest X-rays using AI platform to kind of replace a radiologist's reading of X-rays, because that has revealed that there is 30% increase, 20 to 30% increase in positively predicting TB in a patient just by using AI platform in consonance with the chest X-ray. So that, and then AI for predicting disease. So, for example, there are AI platforms for patients who have diabetes to predict if they are more predisposed to having diabetic retinopathy, for example. Similarly, there's so many illnesses, cancers, that we are using technology to predict and then treat.
One last question, ma'am. How do you like the conference attending here and being part of the second edition of the India Diagnostic Summit? If you could just say a few words.
So I would like to express my gratitude for having invited me for this, because it gives, it's good to interact with the best minds in the diagnostic industry and to know, what what is the thinking there? And it also gives us an opportunity to partner. So I would say, to be able to reach the last person, the most marginalized of the lot, traveling that distance to reach the last mile, to be able to provide the best quality health service to that person, we need to have partnership between the public sector and private sector. And such conferences provide a good platform for that.
Thanks a lot, ma'am. Thanks for
Thank
taking
you,
it.
Pratima.
Thank you.